it would be always difficult to talk about good and bad practices, but I can talk about what can be a desirable way of managing patients that can have symptoms that makes the GP to think about that condition. And then we have to rule out that condition of IBS, the DGBI in the lower part of the body of our patient. It would be good to do it proactively and to try to diagnose. A good way, a good practice would be that doctor who tries to use wrongful criteria to rule out problems and not to diagnose this condition for exclusion. That still is a lot of that. So I would say GPs will have to take more leadership in being confident in the possibility of symptoms-based diagnosis. That would be my message. Obviously, always to rule out red flags whenever something can be wrong in the physical way of maybe a physical condition. Symptomatic possibilities may help that, but sometimes we need to make a diagnosis, lab test, whatever, but always with that positive way and not in an exclusive way for the diagnosis. Well, this is a very good question because there's always the issue of how to handle the problem with the patient. First of all, I think that it's very difficult to manage this condition if the GP is not having that good communication in terms of providing empathy. Patient has to need to feel understood, and this is not always easy. Patient needs to be validated on their symptoms, and doctor has to make that approach. And a good way as well is to explain what that DGBI condition means. And the role of the DGBI axis means that there is a connection between the gut and the brain, and patients understand that very clearly if doctor is very proactive in doing it. So we have to do it properly, and this is part of the psychoeducation. This is very relevant to help patients in understand what is wrong. And this is the best way to start moving for better outcomes for future. Well, again, this is very relevant because gut microbiome has been shown to have different composition in patients that are suffering from IBS. And then it seems like a proper composition on this microbiome, on the gut composition of the microbiome, will help and helps patients with better outcomes and avoiding symptoms. So there is the issue of what is before and how we can modulate that. But it seems like in the evidence, there is an increasing evidence about the better outcomes on patient symptoms whenever we modify their microbiome, their gut microbiome, from specific treatments on probiotics. And this is something that is very relevant and that we have to take into consideration to help in patients' treatment whenever necessary. And this is an open future for having a more personalized treatment according to patients' specific gut microbiome composition. In my experience, if you provide probiotic treatment to patients, seems like most of the symptoms in general, but most related to bloating and difficulties, usually more in the diarrhea, both diarrhea or constipation can be better modulated when patients are having a probiotic help, apart from other maybe possibilities of treatment on the symptom-based profile. But yes, there's usually a quite good outcome on patients' perceptions on symptoms, specific GI symptoms. Well, again, this is a great question. I think microbiome is already playing, but it will increase its role in the future in two areas mainly. On the diagnosis area, for better knowledge about the healthy composition of gut microbiome and how we can personalize that possibility for not only illnesses, but also for what we can call the bowel health, or we can call the gut health, that at the end will be like people's health. And even there's going to be a role on that. So this is a huge amount of possibility, not only for that, and also for the therapeutical aid in aspects like IBS. There's already some toolkits that I think there has to be more evidence on that and how that can help in a positive way for diagnosis management and for therapeutic aid as well for patients to do it in a more proactive way from personalized treatments according to patients' situations on their own specific gut microbiome. So the future is still starting, but there's a lot of possibilities here, and hopefully there's evidence that that way of having microbiome help and trying to increase the good, I would say, the good microbiome components of the gut, that is increasing better outcomes of health in patients. So we have to have more evidence how to rule out that, how to make that possibility for better patients' outcomes. This is the future, but I'm sure it's coming in the next few years.